My name is Christina Rios. I am a UIW Rehab Science student. I will be doing a presentation on spinal stenosis rehabilitation. All right, so let's meet our patient. She is a 21-year-old female named Nicole Robertson. She recently joined the Air Force, and prior to the Air Force, she was an inactive individual. She loved spending time playing video games, watching movies, and hanging out indoors. She noticed her pain when she was doing a physical test in the Air Force. She was running on uneven surface. She hit like a curve in the ground, and she felt immediate pain in her lumbar region, and then shooting and numbness pain going down both lower extremities. Our patient was officially diagnosed with central lumbar spinal stenosis. Here on the left, it's showing a normal spinal canal, and then on the right, it's showing the narrowing, the stenosis going on in the spinal canal, which is going on in our patient here. There's two different types of spinal stenosis. There's central spinal stenosis, which is on the left, and lateral spinal stenosis on the right, which is going to be an impingement on the peripheral nerves. Both of these are usually more common in the elderly population, not so much the younger population. Our patient was most likely born with a congenital defect, where she was just born with a narrower, smaller spinal canal than most. So when she did that quick movement and she just wasn't used to the physical activity, it might have just had that onset of pain and where it started actually bothering her. The signs and symptoms of spinal stenosis, the patient can present themselves with a leaned forward position, which our patient did, as well as numbness and tingling shooting back down either one or both lower extremities. If it was lateral spinal stenosis, it could maybe only be shooting on one side. Since our patient does have central spinal stenosis, she felt her pain going down both lower extremities, and she stays with her body in the hunchback position. She expresses that once she is standing completely upright, or anytime the gravity is just weighing on her, the pain is much worse. When laying down, she doesn't feel as bad as when she's standing. So what causes spinal stenosis? As with our patient, she has a congenital defect, so it's not going to be any of these. It's just going to be something she was born with. But to just talk about it, in elderly, you could get a herniated disc right here. You can get a bone spur, like shown here, or a facet joint hypertrophy, as shown right there. So those are all the ways, and it's just the impingement of a spinal nerve that's going on. All right, so what has our patient done so far? She has been seeing a physical therapist for a few weeks now since the incident happened, and she also recently received an epidural injection where she felt no relief of pain. This is usually done to relieve some of the back pain. It's also common in other back pain, but for our patient, it had no effect. So what's the next step for a patient? The next step is going to be a surgery. It's called the lumbar laminectomy surgery. What's going to happen is they're going to go in, remove the lamina from her spine, and take it away. And it's going to release the nerves from all that pressure, that tightness that was going on. It's going to be fused with some bolts, and they will put some bone grafts are going to go right here and right here. And once that fuses together, they can go back in and remove those bolts because it will be completely fused together. So there's going to be 3 phases to the rehabilitation process for her. Phase 1, we're going to be really focusing on maintaining the integrity of that surgical site, as well as decreasing any pain and inflammation that's going on. We're going to bring in range of motion, as well as focus on body mechanics, transfers, and positioning. And then we're also going to start a walking progression and increase the tolerance for that throughout the entire rehabilitation. To just look at 2 exercises we have here, we have diaphragmatic breathing, as well as TA bracing, which is transverse abdominis bracing. For diaphragmatic breathing, we want to breathe in, push our belly out, breathe out, suck our belly in. And then next you have TA bracing here. You can put your hand, put it under your, right under your lumbar region. You want to get your belly button and push it all the way to the ground. And that's really going to focus on strengthening your core. And these are great right after surgery because you can do them both laying down. So phase 2 goals, we're going to make sure we're still letting those tissues heal. We're going to keep decreasing pain and inflammation. Now we're going to be introducing active range of motion as well as really strengthening the core and lower body. 2 great exercises for this would be the elliptical because it's low impact, as well as the one-legged bridge that we have here. Just make sure you keep that leg that you have in the air parallel with your leg that's stabilizing you. And make sure you're squeezing your glute and then releasing. Phase 3 is really about getting our patient back to work. We're going to introduce the home exercise program to our patient. We're also going to increase lower quarter flexibility and making sure there's proper activation of the glutes and core. And we're just going to also keep increasing the strengthening exercises that we have been throughout rehab. 2 great exercises here. We have running and sit-ups. Just the normal sit-up. Both of these exercises are foundations in the military, so it's important that she gets these down before we let her go on her own. Take-home exercises are so important and sometimes pushed to the back burner because it is on the patient to get them done. Nobody is really holding them accountable. I wanted to ensure they were really easy to follow because our patient is in the Air Force. She's in the boot camp process, so she doesn't really have access to a gym, but she always has access to a flat surface. So we have stretches as well as exercises. The stretches, there's just 2 of them, child's pose and knee to chest, holding for 45 seconds, and she could do these twice daily. And then exercises can be done every other day, consisting of planks, squats, front lunges, bridges, and either a long walk or a jog, consisting of different sets and reps.